Welcome to Eye Surgeons Associates. I'm Dr. Benevento, one of ESA's cataract surgeons. Since 1984, we've provided eye care for your entire family for a lifetime. We've created this video to provide you and your loved ones with information about and informed consent for cataract surgery. Our team of skilled surgeons, highly trained technicians, and nursing staff have successfully restored vision to thousands of patients for decades. All of our doctors are board certified by the American Board of Ophthalmology. In this video, our cataract surgeons will explain what cataracts are, how we remove them, and what to expect on the day of surgery. They'll review problems that sometimes occur with cataract surgery. Though the vast majority of people do well with cataract operations, it's important to know your risks. Finally, they will also go over advanced technology options, some of which can make you less dependent on glasses. Next, you'll learn about cataracts and their care.
The lens sits behind the pupil and helps focus light on the back of the eye. Any clouding of this lens is called a cataract. Everyone will develop a cataract, but not every cataract needs to be removed. Cataracts rarely harm the eye, so you don't have to get rid of them to save the eye. Sometimes a change in glasses will help for a while, but in general, the treatment is surgery. During your exam, we discuss your general health and other factors which might affect your surgery. Our certified technicians evaluate your vision with modern equipment. When we remove the cloudy lens, we also remove your focusing power, which is then restored by a lens implant. We measure the length and shape of the eye to calculate the lens implant power. Since contact lenses affect the shape of your eye, they must be removed for a period of time to obtain the most accurate measurements. For cataract removal, two main choices of anesthesia exist: numbing drops or shots around the eye. Numbing drops on the surface allow patients to leave surgery with the eye uncovered and immediately begin to recover their vision. Numbing shots around the eye are reserved for patients who are very sensitive and cannot avoid squeezing and moving their eye. Shots around the eye prevent this eye movement but do carry a slight risk. They require the eye to be taped shut for a few hours until the numbness wears off and the eye can protect itself again. Both techniques keep your eye comfortable. Most patients receive some relaxing medicine by vein. Cataract surgery rarely requires general anesthesia. Our staff schedules your surgery. They review your medical history and may arrange a physical examination and appropriate tests by your personal physician. Please notify us of any change in your health, medications, or vision between your cataract consultation and the scheduled surgery. You're ready to proceed to cataract surgery.
We typically start eye drops a few days prior to surgery. The surgery scheduling nurse provides a lid cleanser to use the night before surgery and a prescription for drops to fill at your pharmacy. Bring that unopened bottle of drops with you the day of surgery. Unless otherwise directed, take all your usual eye drops and medications the day of surgery. You can continue your regular blood thinners and aspirin. For diabetics, our nurses will discuss the timing of your medication and food for the day of surgery. If you take medicine for urinary retention, such as tamsulosin, Flomax, or Rapaflo, be sure to tell the scheduling nurse you're on these medications in case there are special instructions. You may have clear liquids up to 4 hours before this surgery, however, do not eat solid foods on the surgery day. Bathe, shower, and wash your hair, but do not apply eye makeup. Dress in loose, comfortable clothes as you'll wear them during the procedure at some surgical facilities. Arrive at the facility 2 hours before your scheduled surgery time with your unopened bottle of drops. You'll be made comfortable in the outpatient unit. For your protection, you'll be asked more than once to confirm which eye is scheduled for surgery. You'll receive eye drops to prepare your eye. In the operating room, we'll make you comfortable with a pillow under your knees and give you relaxing medicine by vein. We will point your nose at the ceiling. This allows the best access to your eye. The nurses will clean around your eye and will place a sterile cover over the eye with oxygen flowing underneath. A small instrument gently separates your lids so you don't have to worry about blinking. We operate with a microscope to create a small incision in the clear surface of the eye to reach the cataract. The cataract is about the size and shape of an M&M. We remove the contents and leave the coating. A new lens is implanted inside the coating. You may see some light and bright colors, but you won't see distinct shapes or feel any pain. If anything bothers you during the procedure, just let us know, and we'll do something about it right away. The surgery typically lasts less than half an hour, and in some cases requires as little as 10 minutes. Since most patients receive sedation, someone must be available to drive you home. Following surgery, it's not unusual to feel some stinging from the drops and some scratchiness. Minor discomfort often disappears with a nap or a good night's sleep. Artificial tears can help. Significant eye pain, decreasing vision, or headache are unusual and should be reported to the office or emergency after-hours number immediately. You may wish to wear something over your eye for protection after the surgery, like glasses. Since the pupil may remain dilated for up to 24 hours, many patients initially prefer sunglasses. Bending and stooping are okay, but don't rub the eye or get anything in it, including water. You'll start using the eye drops right after surgery for 4 to 6 weeks. We'll usually examine you within 24 hours and 1 to 2 more times following the surgery. If your other eye requires surgery, it's typically done 1 to 3 weeks later. This allows us to be reasonably sure that the first eye is healing well before we take any risk with the second. This also minimizes the time that you might feel awkward if the two eyes are not working well together. If needed, we often prescribe glasses a week or 2 after surgery. Here's one of our patients sharing their cataract experience, followed by an introduction to complex cataract surgery.
Before cataract surgery, my vision was terrible. I had worn glasses since I was 5, and through the years it got progressively worse. I ended up having to use a magnifying glass to read the newspaper and the phone book. It was very, very frustrating. I chose the toric lens implant, and now I only use readers, which is wonderful. And I can watch TV without glasses. I recently passed the vision portion of my driver's test. For the first time ever, my license is not restricted. And that is super, just super. But the surgery went very well. It's made such a big difference in my life. No pain at all. It just went very slick, and it truly is a miracle for me to be able to see the way I do now, and I would do it again in a heartbeat. It was wonderful.
The majority of patients with cataracts undergo uncomplicated surgery with a rapid and optimal recovery, but some conditions can make the surgery more difficult. I want to explain briefly some of these conditions and the additional technology that enables us to provide the best outcome for you. Some cataracts become very dense and brown or swollen and white. These require additional use of temporary dyes inside the eye to better identify the cloudy lens. For best results, they also require additional experience with the surgical machine used to break up the cataract. Inside the eye, there are zonules which suspend the lens or cataract. The zonules resemble trampoline springs. They can be broken or loose for several reasons, including advanced age, eye injuries, or certain diseases. We can treat this with a surgical device called a capsular tension ring. You can't see it or feel it within your eye. Based on your eye exam, your surgeon usually can tell if you might need one. The staff needs your written permission for its possible use. Patients with abnormal irises, the colored part of the eye, require added precautions. Some prostate drugs like tamsulosin, Flomax, or Rapaflo can affect the iris. Please let your surgeon know if you have ever taken any of these kinds of medications. Eye trauma and other diseases often require the additional skills of our other specialists. They're available as part of our Eye Surgeons Associates team. Of course, all surgery introduces some risks which will be explained next.
Cataract surgery offers obvious benefits. Because this video is part of your informed consent, I've been asked to comment on the risks involved. When all goes well with cataract surgery, the outcome is exceptionally positive. But with any surgery, there's always potential risk to be considered, along with the expected benefits. The risk to your life is less than having a shot of Novocaine at your dentist. It is possible to develop an infection inside the eye. In the US, this occurs about once every 1,100 cataract operations. The average risk in the hands of our doctors is much less than this. But no matter how careful our sterile techniques are, this cannot always be avoided, and even with immediate diagnosis and treatment, vision can be lost. Extremely rarely, loss of an eye can occur from surgical complications. The retina, like the film in the camera, can detach and require major surgery to restore vision. The center part of the retina, the macula, can swell. This may require additional treatment and may result in disappointing central or reading vision. In unusual circumstances, an implant may dislocate, causing inflammation, or may not be the ideal power for the eye, requiring stronger glasses. Artificial implants may cause halos, inflammation, and thinning of the iris. You may need additional treatments for best vision with any technology. Sometimes a small piece of the cataract can hide in the eye and show up the day after surgery. Occasionally, these fragments need to be removed. The clear front window of the eye, the cornea, can swell or cloud and require a transplant to restore excellent vision. There can be a problem with pressure inside the eye, requiring treatment for glaucoma. All these possibilities and more add up to something in the range of 1% to 2% risk of either a disappointing visual result or may require further treatment for the best outcome. Fortunately, this means that more than 98% of the time, all goes well and the surgery is a painless procedure with rapid recovery that restores vision to marvelous levels. In modern surgery, we remove the cataract and leave its covering bag inside the eye. Sometimes this bag gets cloudy months to years later. Seniors face about a 20% risk of eventually requiring a laser procedure to open this cloudy bag. This occurs more frequently in younger patients. This brief, painless procedure with nearly immediate recovery can then restore clear vision. A discussion of focusing problems and some of the ways to reduce your need for glasses follows.
The decision to have cataract surgery is the first, but not the only decision you must consider. Since we are replacing your lens with an implant, we have a unique opportunity to reduce your need for glasses after surgery. Eyes that don't see well without correction are either nearsighted or farsighted, with or without astigmatism. In addition, as we age, the natural lens loses its ability to focus over a broad range from distance to near, resulting in our need for readers or bifocals. We call this loss of close focusing presbyopia. For years, the monofocal lens implant with a single focal point has been our surgical standard. It is fully covered by Medicare and most insurance. Most people selecting a monofocal implant want the best uncorrected distance vision possible. Since these lenses do not correct for astigmatism or presbyopia, you will need readers or bifocals for full range of vision after surgery. For people desiring more independence from glasses, there are additional options available. Blended vision, advanced technology lenses with and without laser treatment, and additional surgical procedures offer patients the opportunity to reduce or eliminate their need for glasses after surgery. With blended vision, one eye has an implant with the goal of providing distance vision while the other implant is selected for computer or hobby distance. You may reduce your overall glasses dependence with this approach, but it takes a little adjustment. You will likely require glasses for fine, close details. Under certain circumstances, like night driving, you may benefit from glasses to improve your depth perception. One type of advanced technology monofocal implant, the toric lens, corrects for astigmatism so that better distance, near, or blended vision can be achieved. Toric lenses are the most frequently employed lens upgrade in our practice and nationally. These options, the advanced technology lenses, the extra measurements, testing, and equipment required for their calculation and implantation to reduce or eliminate your need for glasses are not covered by your insurance. Payment plans can make these advanced technology treatments an affordable option. My colleague will describe multifocal advanced technology implants that reduce or eliminate your need for glasses.
I would like to share with you information about an advanced technology lens that corrects both your distance and near vision. The multifocal lens offers a greater range of vision and can reduce or eliminate your dependence on glasses. The optical design of the multifocal lens implant splits the light between distance and near images, giving the greater range of focus. Though both images are present at once, the brain doesn't see it in that way. Instead, the brain may recognize the out-of-focus image as a blur, which is most noticeable as a halo around a point source of light. Many patients aren't even aware of this, while others take time to tune out the noise and tune in the information, a process called neuroadaptation. A rare individual may fail to adapt and may require further surgery. Because not all the light is employed for either the distance or near image, the patient may benefit by employing brighter lights for reading. Since multifocals employ less than half the light at one time, these lenses must be used cautiously in the presence of concurrent eye conditions. These lenses are best suited for patients without eye disease. With multifocal advanced technology lens implants, the goal is for you to be able to do the activities you enjoy at different distances with the greatest independence from glasses possible with today's technology. Not everyone is a good candidate for this technology, and no technology is perfect. If you are interested in advanced lens implant technology, your cataract surgeon will work with you to help determine which lens choice is a good one for you.
Eye Surgeons Associates introduced modern cataract surgery techniques to the Quad City region. We were the first to offer outpatient cataract surgery, injection-free anesthesia, and suture-free incisions. In addition to excellent results with traditional surgery, we first offered advanced technology intraocular lens implants to our patients to reduce their dependency upon glasses. After more than 30 years of continuously enhancing your choices, Eye Surgeons Associates was among the first practices in the United States to offer laser cataract refractive surgery. The laser's guidance system creates a unique 3D image of each patient's eye and then uses sophisticated computer software to customize the surgeon's treatment. The computer-guided imaging system employs laser light energy rather than surgical blades to alter the cornea's shape for astigmatism treatment, and it creates a precise and consistent opening in the bag of the cloudy lens and softens the cataract. This technology benefits patients in two ways. It enhances the accuracy of the intraocular lens implant calculation, which reduces the need for glasses, and it also eases cataract removal, protecting sensitive eye structures. Following an eye drop to numb the eye, a small instrument is placed between the eyelids that stabilizes the eye for delivery of the precision light energy. If needed, astigmatism is also treated by the laser, which changes the shape of the cornea. The actual laser treatment requires less than 2 minutes and is painless. Many patients experience a kaleidoscopic light show during the treatment. You are then moved from the laser room into a surgery suite where the surgeon removes the softened cataract and replaces it with the appropriate intraocular lens to complete the procedure. With the use of the femtosecond laser, there are some accompanying risks and complications which will be reviewed with you if you are a candidate and are considering its use with this procedure. Now, Medicare currently limits laser cataract surgery use to advanced technology enhancements or astigmatism treatment that reduces your need for glasses after cataract surgery. Advanced technology vision correction options are not covered by Medicare or most insurance plans. There are separate out-of-pocket charges from the surgery facility for these services and devices. Again, payment plans can make these advanced technology treatments an affordable option. When all goes well, cataract surgery results in clear vision no matter which lens you choose or whether the laser is employed. The purpose of elective advanced technology lenses and the laser is to achieve this vision with less dependence upon glasses. None of these choices is best for every eye or every person. Only you, your surgical team, and your doctor can determine what's best for you.
You've now met our cataract surgeons. As you can see, Eye Surgeons Associates provides the latest proven solutions to protect and restore your vision. If questions or concerns remain, please discuss them with your surgeon or their team during your examination. We feel privileged to serve you, and with your input, strive to get the result that best fits your lifestyle and visual needs. Thank you for your attention.